Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Shekinah in here with us this afternoon, and you can tell Shekinah is not in her full glory right now. She has severe herniated nucleus pulposus down at L4, L5. She is getting severe lumbosacral radiculopathy all the way down her left leg into her toes and the lateral aspect of her foot. She's getting paresthesia, which is numbness and tingling down there. You've already been through, what, 24 chiropractic adjustments so far? Mm-hmm. And you've been taking some medications as well to try to knock the pain. Yeah. And you still had severe pain in your low back and shooting down your leg, right?
Yes.
And why did you decide to come here to see me at Advanced Chiropractic Relief?
Because I want to do everything before I get surgery.
Good answer. So we're going to we're going to adjust Shekinah so we can get her biomechanics corrected in her spine, take the pressure off the nervous system, and that would keep her from having to have surgery. I've already gone over with her the most serious neurological deficits to watch out for, which is loss of bladder or bowel function, or that she can't stand on her tiptoes or her heels, which I've already checked both of those. She does not have foot drop. By the way, I'm going to make this disclaimer again because I need to. These videos are for patient education to show patients the benefits of chiropractic care, not for people to start trying to adjust other people. It has come to our attention and it's become a big deal now that people are out there trying to do these things on the public and they're not even licensed chiropractors. I've been doing this for 40 years now, and I have been licensed to practice chiropractic in the state of Texas since July of 1981. That's 39 years actually. So I know what I'm doing. If you're doing this on people at home, you need to stop it immediately. Don't ever let anybody touch you besides me on this.
Okay.
Okay, so I'm gonna have you just close your eyes for a moment. You kind of flex your head forward and backwards. Okay, so she got a little kink. Did you feel that going backwards? How it kind of kinked up there? Mm-hmm. Okay, so we did, is it okay if I show them a couple of the tests that we did? Let's lay you on your back for a second. Now, when you've got a patient that's got a serious condition as she kind of has, you have to do these orthopedic neurological tests on them. Now, this is her good leg, mind you. It's called a straight leg raise. And see, about right there, she starts feeling some tension, but it's not just here on this right side. She's actually feeling it contralaterally over into her left lumbosacral nerves going down into her legs, right? Those get worse the further up I go. So that's a positive straight leg raise on the right with contralateral radicular findings. Now this left side, which is her bad side, about right there, she's already starting to feel it. I can feel it in my hands, and I can see it in her face as well. So I'm not going to take her past that. This is also very important to test the muscle strength. Go ahead and push, pull up, turn in, turn out, push, pull up. See, that's hardly even there. You feel that? Turn in, turn out. So she has significantly weaker left lower extremity muscles in her, going into her ankle and in her foot, which are supplied by the nerves out of her lower back. So let's go ahead and turn you back on your tummy now. Now I've already done her history and all these exams. I was just doing that to show you the severity of some of these conditions. Her right leg is 3/4 of an inch shorter than her left leg. When I bring her legs up, it starts hurting already about right there, doesn't it? She kind of, and then the further I come up, see the legs get even? But that tightens up more and more in her low back and pelvis. Now in her biomechanics standing, her pelvis had translated way to the left on the x-axis. So I am adjusting her in a mirror image. So I'm putting her in negative SX pelvis. And I'm going to adjust her right SI for the first time. I told her these are going to be a little sore at first. We'll feel better when it quits hurting. She kind of. There we go. That's it. Now I could adjust and talk and chew gum all at the same time because I've been doing it for so long, but that don't mean you should. There we go. Now, proof's in the pudding. What do you see now? They're exactly even. And I bet you this doesn't hurt as badly as that first one did. You tell me though.
That's not the same.
It is?
Yeah.
Okay, well guess what you're getting? A dose of my elbow. This is deep tissue work. I'm down in her quadratus, lumborum, multifidus, and erector spinae muscles right now. Keep breathing for me. Don't hold your breath. I know this is painful, but it'll help. Right one's worse, isn't it?
Mm-hmm.
Okay. This is one of those hurt so good treatments. You're gonna hate me now, but you'll be loving me later. I'm sorry. I know it's horrible. I'm not taking any pleasure out of this. I promise you. But it has to be done. We got to get you over the hump. Well, that's really sore, isn't it?
Mm-hmm.
Yeah. She's had lateral tensorfasciolata pain since this is all started, so I'm just going to do some muscle spindle work on her TFLs, which is her tensorfasciolata muscles. A lot of people call it the IT band. It's not really just the IT band, it's the tensorfasciolata muscle under the fascia, which is the IT band. That one's pretty sore too, though, isn't it?
Mm-hmm.
And you'll be able to see when you watch your own video that I'm leaning my entire body weight into you. See, this one's sore too. You got some crushed ice at home?
Yes.
I want you to put a baggie full, like a Ziploc baggie full of crushed ice directly on your skin. Not through a towel or shorts or shirt or anything, but right on the skin for 20 minutes when you get home today. Okay, so I'm gonna get back over here and adjust your lumbars now. Okay, breathe. There you go. That's all of them. Yep. Okay, tell me about this one versus the first one. Is that better?
Mm-hmm.
Okay, good.
She doesn't sit there say anything different.
Yeah, she'll be at my knee next. Okay, I'm gonna put this curve back in your cervical spine too, because of your posture, your cervical lordosis and your lumbar lordosis have been straightening out. Okay, let's turn on your back slowly. Okay, so in this one, you're just gonna feel like I'm adjusting your cheekbones, but I'm not. I'm bringing your head up and over your spine.
Okay.
If you didn't know any better, you'd think I was adjusting your cheekbones, wouldn't you? Okay, put both arms straight out to the sides, palms facing up. So I'm going to be adjusting your AC joints in your shoulders, your clavicles where they attach to your sternum, and then your anterior rib cage, which is called the costo-sternal joints. Ooh, those were tender on the right, weren't they? Okay, let me have this right leg. You can keep that one there. There. Did you feel that all the way up into your lower back?
Yes.
Okay, good. Now let me have this left one. Keep your right one up there, though. Breathe. There you go. How far did you feel that one?
Pretty far up.
Up into your lower back?
Yeah.
Good. Okay, I'm gonna help you up sideways, so let's turn sideways. Yep, bring your legs over. There you go. You always want to get up sideways like that. Don't ever sit straight up. You probably heard me say that on videos, haven't you?
Yeah.
There we go. You should have been in here Monday. I could have seen you 3 times this week.
We tried.
Oh, we were packed.
We've been waiting a month.
Have you really?
Yeah.
We've been booked out about 2 months, so I'm lucky you got in then. I'm glad you got in though.
Yes.
There we go. Feel that?
Mm-hmm.
You just, all your joints are misaligned now that you've got that discombobulation going on in your low back and
Yeah.
pelvis.
Yeah.
Everything's getting out of place.
Yeah.
Okay, let me help you up. We're gonna come on this table, lay on your back. Now this might be something your little brothers tried to do on you when you were younger. Let's slide up this way. That's good right there. Okay, so I'm gonna lock your pelvic bones in here. Slide down underneath that a little bit. Yes, it's supposed to be. Just rest your hands right there on your tummy. Good. I'm gonna bring your legs up, so just let them be in there. Relax with the table movement. This is how you should start sleeping from now on. You kind of with your legs parallel to the floor. Like if you were to go home and lay on the floor and put your legs up on the couch or a footstool, that's how you should be sleeping.
Okay.
That should feel more relaxed in your lumbar spine right now,
does, yeah.
instead of having your legs flat out.
Mm-hmm.
Good. And I just wanted to show you that because I did a comprehensive orthopedic neurological exam on her before. Her reflexes are still intact. Her muscle weakness is her biggest deficit neurologically. Breathe with your left ear. There it is.
Oh my gosh.
Yep. That's the most common reaction we have. You probably saw Ship's Shekinah glory there, didn't you?
Just like Jesus.
Yeah, yeah. I see Jesus every day when I do this. There you go. Let me do it, hon. That's it.
Oh my gosh.
Yes, ma'am. That's a real adjustment. Don't worry, it'll feel better when it's hurt. And I'm not trying to be funny there, that's the truth. It's probably going to take a few times of doing this to get you over the hump, though. Let me help you up sideways. You'll turn sideways. Yep, there you go. Okay. I want you just to walk around just for a second, and I want you to tell me what you feel different right now. You're going to be sore, so that's the first thing you're going to feel.
feel sore.
Okay. You're not bent over as badly.
Yeah, I feel like lighter.
You're straighter too, yep. See our pelvis is not so far shifted over to the right now? Yeah, just relax, there you go. So you got a little room now.
Mm-hmm.
You didn't have any there a second ago.
Yeah.
So I'm gonna show you your homework. Your head's forward and to the right, your pelvis is shifted left, so you're gonna pull both shoulders up, back like this, flare these guys here. Get my gun. Texas, they shoot horses, don't they? Yep. Okay, you're forward and right? So we're gonna go left here. Now shift your pelvis straight right towards your mom, as far as you can. That way over to the right, just like I had you on the table. Now let me have your neck on. There you go. I'm gonna adjust your atlas while you're in a mirror image of your biomechanics. There you go. Okay. Now, when you flex your head forward and backwards again, this should feel a little smoother to you than the previous ones.
Mm-hmm.
Does it? There we go. We're making a little headway. I mean, that's pretty much all we can ask for on the very first visit.
Yeah.
So as soon as you get out of here, even on your way home, you should get some crushed ice and put it in a freezer baggie. So stop and get you a big gulp full of crushed ice and pour it in a freezer baggie.
Okay.
Put it right on the skin over this lumbar spine, L4, L5 area.
Okay.
And then just 20 minutes. But take it off at 20 minutes.
Okay.
Because at 20 minutes and above, it causes more inflammation. And you don't ever want to put heat on this ever.
Yeah, I don't.
Okay, good. Other than that, drink a gallon of water every day for the rest of your life, and I'll see you on Monday.
All right. Sounds
Yep.
good. Thank you.
So what would you tell our YouTube crack addicts around the world about your first experience here at Advanced Chiropractic Relief? The whole deal, though. No, I want you to tell them what you feel that we did here differently than what you had done for the last 24 visits.
Oh yeah, it was a lot different, and I've already felt a lot different than my last 24 visits, especially with that.
Was your history and examination thorough?
Mm-hmm.
Yeah.
Yeah.
Have you ever been examined like that before?
No.
Yeah. Okay. Well, she has a severe herniated disc with lumbosacral radiculopathy. That is something that we do here at Advanced Chiropractic Relief. We help people decompress non-surgically through the manual spinal decompression adjustment that I do on the y-axis. And that will take the pressure off of the disc, off the joints, and eventually off the nerves once we get this inflammation down.
Okay.
So right now, I don't want you laying around all weekend.
Okay.
I want you up walking around. You have a swimming pool?
No.
You have access to a swimming pool?
Yes.
I
Then
do.
that's the thing that we need to start getting you in is aquatic rehab, because aquatic therapy, physical therapy in the water basically, and I can write you a script to go see some people and show you that stuff, and then you can start doing it at home if you'd like to.
Okay.
They're up in Humble that I refer to, but they're really good, and they can show you what to do, and then you can go do it in your pool,
Okay.
right?
Okay.
I mean, because that's the best thing to do in conjunction with what I'm doing.
Yeah.
Because you got to keep moving. If you stop moving, and she had a big brace that they put her in somewhere, I'm not even sure where, but anyway, that was causing her to lean over like this the whole time. And you don't put braces on these kind of conditions because that weakens the intrinsic muscles of the spine, the red muscle fibers, which are the long-term stretch and endurance fibers. That's the ones that hold us upright all day, every day. And she was losing that because she'd been wearing this brace for how long?
A month or two.
A month or two. Well, guess where that would have been the first day I saw you? In the trash, which is where it would have been if she wasn't holding on to it. Do you have any questions for me?
I don't think so.
Do you have anything you'd like to say to our crack addicts in the finale of your video?
I'm not good on camera.
Yeah, you are.
No.
You're better than you think.
Dr. Johnson.
Huh?
No, she's,
Yeah.
I'll let her make that decision over the next few visits. But I believe she will have a good outcome doing this particular procedure on her. I wouldn't have accepted her as a patient if I thought it was dangerous to do this on her. They wanted to do surgery on her back, which is spinal decompression surgically. That's what they call it, is decompression surgery. I'm doing that on her non-surgically through the manual spinal decompression y-axis adjustment that I do. And I think you'll start seeing some of this stuff calming down over the weekend as you use the ice. And you can do that every hour, by the way.
Okay.
So 20 minutes on, hour off, 20 minutes on, hour off.
Okay.
And you gotta drink more water though.
Yeah.
I can tell you're a Coke girl or iced tea girl.
Sweet tea.
There you go. It's like Renee.
Yeah.
Yep. Okay, Shekinah, this is your first visit. Welcome to Advanced Chiropractic Relief. And this is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief with Shekinah. And we see these type of difficult spine cases here every day. I love a challenge. So if you have a severe spine case, email us and go to our website, advancedhoustonchiropractor.com, and we'll see y'all soon.